vertigo can be termed as labyrinthitis, dizziness, lightheadedness, inner ear vestibulitis. All these mean the same thing. And if you understand the basics of balance, you should be able to figure out how to, or what to expect when we as physicians see, hear, and treat vertigo or dizziness. Basically the body, from when you're first learning to crawl all the way up until you learn how to use a cane, the body relies on several different organ systems to maintain an upright position and balance. So the big one is the cerebellum. This is the brain, the cerebrum, and the cerebellum. The cerebellum sits back here, and it's responsible for balance and what's called proprioception. It takes the information that comes from the environment and is interpreted through the eyes, the ears, the joints, and it kind of puts it together and helps you react, helps you walk, helps you stay upright, tells you which way is up when you're swimming under the ocean. So these two things are semicircular canals. They're essentially hollow, I call them three hollow pipes bent in a U, all connected at one joint. And the hollow pipes have a little rock that sits in the bottom of each of the pipes. Now you can imagine it, if there's fluid in here and if there's a tiny little bone or a rock that sits in a hollow pipe, every time you turn this contraption, depending on which tube and which tube you're considering, the rock falls to the bottom of the tube or the lowermost portion of the tube. And whenever the rock moves to the lowermost portion, there are little tiny hairs in this tiny tube that get stimulated to say, okay, the rock's down here, the rock's over here, the rock's over here. And the brain uses the 6 different tubes and the positions of the bones in the 6 different tubes to tell you, okay, you're 30 degrees tilted to the left because of the way the 3 tubes are positioned here and the bones are giving that tactile feel, and the way the 3 tubes here are reacting. They're sending input to the brain, and the brain is interpreting that as 30 degrees tilted to the left. And while we're here now, I'll talk about what happens when you have problems with the inner ear. Again, there's supposed to be endolymph or fluid in these canals, and there's supposed to be an equal size rock, we'll just call it a rock, a bone, in the tube. So when there's regular fluid, let's just say water, and you turn to the left in a little bit of an incline, the rocks will fall to the most dependent portion of each of the tubes. Imagine that this ear, though, has an infection. Instead of water, you now have oil. You have water in this one, and the rocks fall at a certain speed depending on the tilt. And you have oil in this one, and the rocks fall at a slower speed with the same tilt. And that means these rocks will be falling while these guys have hit the bottom of their independent tubes. These guys are still falling. So the brain is getting in the interpretation after you've already made a change in position that the rock is still falling, and technically it's thinking, the ear is thinking that we're still turning slowly. So the brain has to interpret, is this the true information or is this the true information from the bad ear? And that's why people sometimes get dizzy, because the brain doesn't know which ear to interpret. That's what usually happens when you have an infection to one ear. These semicircular canals are located in the same area as the hearing or cochlea is located, in the ear, the middle ear. So when you have an infection in the middle ear, it affects the cochlea. Sometimes it decreases the hearing. It definitely screws up with some of the fluids that are in here. So that's the basics of what happens when you have an ear infection. There's also the eyes that play a very important role for the determination of knowing where you are in space. So it can tell you that's the sun, that's the ground, that's the water, it's flat. It can tell you that you're probably on the ground. It can tell you where the horizon is. It can tell you what's up and what's down. So the feedback that you get from your eyes will tell the brain, again, you're tilted or you're not tilted. So using that and using the ears, if you have problem with the eyes, if you have problems with beating eyes, or it's called nystagmus, or a problem with focusing, it can also get you dizzy. In fact, that's one of the signs that doctors look for in getting a workup for dizziness is a nystagmogram. We'll have you look at a series of different fast-moving objects, and your eyes will usually beat fast in one direction. That's called nystagmus. If you have nystagmus beating to one direction, it tells us that there's probably a lesion in the brain or a problem with the ear on one side. That's a test that we use. A lot of ENT doctors will use to prove or disprove whether there's a problem with the peripheral balance organs. I put this down here. This is a knee. This is a big foot. Because also what a lot of people don't realize is that the knee joint has these little Golgi tendon organs, these little receptors in the muscle cell that tell you or tell the brain that your knee is bent, or the foot is touching the ground, or the toes are lifting up. There's a feedback between the tactile response from an extremity and the joints, and then the brain. There's normally going to be an override to the more primitive responses of balance. But when you have somebody who's been aging, has degenerative joint disease, or has Parkinson's disease, where they have a poor feedback loop between the brain and the joints, you'll have shaking. You might have the sensation of dizziness or lightheadedness because you don't have the good feedback of the information from the joints anymore. Sometimes you can get that in peripheral neuropathies like diabetes, or other diseases like Parkinson's or Huntington's chorea. So this is why it's so important not only to consider the brain as being a source of the cause, for which you get an MRI, looking for tumors or looking for abnormalities with the cerebellum, but the ears as being the cause, and that's where you would get an ENG from a specialist. The eyes being the cause, that's where you go to a retinologist or at least an eye specialist, a neuro-ophthalmologist, or the joints, and that's where a neurologist or an orthopedics doctor, I think a PMR or physical medicine and rehabilitation doctor would be appropriate as well. So these are all very important to play into how we as doctors look at the reasons for vertigo or dizziness. Now, knowing all this, once we find the disease or where the disease is manifesting mostly from, that's when we get people to balanced or vertigo clinics. There are physical therapy centers that take care of orthopedic problems. There are also physical therapy centers that take care of vestibular rehab. They actually will tell and retrain the brain to either ignore the signals coming from the bad organ, or to trust more in the visual than the auditory or the vestibular, or trust more in the joints, or at the same time turn off the joints, forget about the sensation here and trust more of this. So you see the vestibular clinic is very important for figuring out which are the predominant problems and strengthening the weaker pathways. You always have an option of different ways to go with regards to which organ systems need help and which organ systems need to be turned off, which are too stimulating or giving the wrong information. So that's why it's really important not to just look up how to do exercises and then do them on your own. That will work with a small percentage of people, but I think that vestibular rehabilitation is very, especially with multiple diseases that we see at later ages in society, I think it's very important to have a professional that's been well trained help and look for the nuances of what would be the strength in you that they embrace, what would be the weakness in you that they help fix. Likewise, there are also medicines that can be used to calm down the symptoms that are going, or the signs and the feedback that are going back to the brain. You can use medicines, prescription medicines, to turn off and dull those abnormal signs. Unfortunately, the side effects of the medicines are usually drowsiness, difficulty with driving. So you have to take the side effects, and if it's worth the good effects, then you deal with the medicines. There's also other things to try, such as physical therapy. Acupuncture is a great modality when you have gone through physical therapy, you've seen this best ENT doctors, you've seen a neuro-ophthalmologist, and you're still having problems. That's when I usually will say, when the docs have given you the "that's all we can do" kind of signal, that's when it's important to try to consider medicine or healing outside of Western medicine. And acupuncture is a fantastic way to try to embrace other forms of healing. It would take too long to explain how it works, but trusting the techniques of a true Chinese medicine trained doctor would be important. I'll put a link to a little bit of an introduction to acupuncture or traditional Chinese medicine. Yoga as well is also a great exercise to perform, in addition to Tai Chi, to strengthen balance and gait training.